Good evening, everybody. Thank you so much for joining us. Um, especially on this very sunny day, I'm joined today by Isabel, our in-house fertility nutritionist, and we are going to be talking about optimizing nutrition for IVF success. We should answer most of your questions as we go through. There's lots of information throughout the presentation. Feel free to ask any questions as we go along. We'll either answer them as we go, or it may be that we save them till later. Might also be that we know that the answers will come up later on in the presentation. So we will answer hopefully all of them, as many as we can. So yes, thank you very much.
So I'm Isabel. I am a nutritionist. I've been working in fertility and IVF for 20 years, many of which alongside Zeta. And I work focusing both on male and female fertility because obviously they're both just as important as each other. In my experience, it's very common for men to be sat in the corner and told to be quiet, but that is not necessarily what it's all about. And I think, it's just as important for men and women to be on an equal footing. There is so much about nutrition and fertility and IVF. And I just try and keep life a bit simpler because, there's certainly lots of positive things that you can do. There are things that we can look at controlling ourselves, but there is so much stress around this anyway that I try and keep the stress out of it if I can. So I try and make it very doable for people, and explain along the way why something might be important and why it's not important.
Brilliant, thank you. So we'll just look firstly at the foundations of fertility nutrition overall. So this is an idea of a fertility diet and how you should follow with these main food groups.
Yeah, so essentially, the diet, I mean, if there was a specific diet that people had to eat to have a baby, frankly, there'd be no kids in the world. So obviously, there isn't a perfection. Nobody needs to be perfect, but studies do show that a diet following a higher protein, lower carb, Mediterranean style diet is one of the best things you can do. And that really means lower in processed foods, lower in saturated fat, rich in brightly coloured fruit and veg. The antioxidants are super important. We will be talking about that a little bit later on. Some good quality protein, both from, obviously, if you're vegetarian or vegan, it's only going to be coming from, plant or non-meat or fish sources. But if you are not, then some good quality lean meat and fish, and essential fats. A low-fat diet is not a good idea from a fertility perspective.
Thank you.
I'm
So,
so sorry, everybody. I feel really bad about this. I just wish I knew what I
oh,
could do.
don't
It's
worry.
really weird.
Yes, it feels strange talking.
I
It's fine.
know. I'm so
It's the
sorry.
information. That's what we're here for. So don't
Okay.
worry. Thank you. So yes, protein to focus on to start with.
Yeah. So basically, we are preparing obviously for IVF. Now, as I mentioned a bit earlier on, a higher protein, lower carb Mediterranean style diet is the way to go. But from an IVF perspective, for the female particularly, your protein requirements go up considerably. So protein provides the building blocks for growth, which means it's important obviously for egg and sperm quality as well as hormone production. And for a female going through IVF, obviously the aim of an IVF cycle is to stimulate your ovaries to mature as many present follicles as possible in a safe environment. So that is the medication's job. Whilst that is happening, your job is to feed your eggs, and protein, is one of the main food sources. So our protein requirements are much higher during an IVF cycle than they might be during normal life or even for a more natural conception. Protein also has another role in that it can help modulate, if you like, hormone balance. The more balanced our hormonal system, the more efficiently the body works, and the more efficiently the body works, the better quality everything's going to be. And that is the obvious everything from mood and energy, but also from a fertility perspective, your hormone production, the way you ovulate, the way you produce sperm, the quality of your eggs. So the hormone balance is really, really important. And I think we'll be talking a bit in a moment about how protein can support blood sugar control, because blood sugar control is really very important from an overall hormone balance as well. But particularly with IVF, it is also to feed eggs. That is really, really important.
Yes, so as you say here, the blood sugar balance, looking at that um, in here.
Yeah, so basically, when sugar enters the bloodstream, the pancreas has to secrete insulin. So you get what's called a sugar surge, depending on how sugary your food is. But even if it's a carbohydrate or fruit, people forget that fruit is actually essentially a carbohydrate. It can go into your bloodstream quite quickly as sugar, which gives you a spike. And this actually can affect, it can upset hormone balance, it can increase inflammation. It's not ideal to have these spikes. So if the quicker it goes in, the quicker it comes out. You get a spike, you then get a dip. And then over the day, actually we get into a pattern of these spikes and these dips, which is not great for overall hormone balance. The role that protein has actually, and fat as well, and I did mention a bit earlier on that, low fat is not really the way to go. Protein and fat reduce the speed at which sugar enters the bloodstream. So if you include some kind of protein, which to be fair, normally goes alongside some fat anyway. If you include protein and fat with each meal, it stops your, and each snack as well, actually, it stops your blood sugar from spiking. So it keeps your energy levels more stable, it keeps your hormones more balanced, it keeps your appetite, it stops you craving sort of foods. But overall, our bodies function better. So I tend to say, try and include some kind of protein every time you eat. And one of the really important times actually is at breakfast. How you eat at breakfast sets the tone as to for how your body works over the day. And so it can help with, evening out all sorts of hormonal sort of issues, but also cravings and energy and mood, in fact, as well, and sleep. It's really, really important and it can be really helpful.
Brilliant, thank you. Um, so just now we'll move on to looking to see what you can do to improve quality of eggs and sperm, particularly through nutrition. So looking first at egg health.
So yes, I mean, and I get a lot of people going, "Oh, I've been told that there's nothing you can do to support egg and sperm, to improve egg and sperm health," and that is categorically wrong. I mean, we know that from a sperm point of view because there's a lot of study done on sperm. Currently, there is no test for egg health, actually, as it is. But we know, obviously, because they study eggs and sperm are essentially casings for strands of DNA. Plus, of course, they study eggs and female fertility in animals. And so we do know that there are certain things that may support egg quality. So these are the sort of in a sort of a snapshot. Vitamin D is a really important one for both male and female fertility. And we are becoming a vitamin D deficient people, if you like, because we are inside a lot. If you're in the Northern Hemisphere, particularly in Britain, the weather's not always great, but we wear clothes. And then when we go out, we're told that we can't go out without putting factor 20, 30, 40, 50 on because we don't want to get wrinkles, but nor do we want to get cancer, quite understandably, by the way. But actually, we're not designed to be like that. And vitamin D is, so we are becoming low in vitamin D, really important for all aspects of fertility. And, for egg quality and sperm quality as well, actually, for the DNA, in fact. Folate is the other obvious one in that a lot of people will talk about it in a bit more depth, I think, a little bit later on about the difference between folate and folic acid. Essentially, folic acid is the synthetic form of folate, but folate is one of the most important nutrients from a fertility perspective, both male and female, actually, I have to say, for all sorts of aspects of fertility, but also for egg quality. Omega-3, in my experience, I see very few people who actually have enough omega-3 because it's very difficult to get enough omega-3 from the diet, particularly if you are vegetarian or vegan. But even if you're fish eaters, because we're not recommended to eat so much oily fish because of the pollutants in the world and also because we don't want to overfish the seas. So omega-3 really important for egg quality, and it may delay ovarian aging. It's important for implantation and actually during pregnancy as well. Um, Antioxidants, I'm going to talk about a little bit later on about how important they are for all aspects of fertility. And then we've got coenzyme Q10 that we're also going to talk about later on, which is really important, and inositol. And these are snapshots of some of the nutrients that are important.
Brilliant, thank you. And then looking at sperm health as well.
So again, many similar. It's all very similar. We've got the vitamin D, we've got the DHA, which is actually one of the active forms of omega-3. So DHA is concentrated in the sperm head. It's really important for the actual DNA, in fact, but also for the cell membrane and for the sort of the form of the sperm in order for it to be able to penetrate the egg. It's also important for motility. It's found in the tail as well. So again, many people low in omega-3. So always something I would recommend for a couple trying to conceive, and particularly going through an IVF cycle, because as I say, it can also improve the actual DNA of the sperm. Folate is as important for a man as for a woman. Same reasons, important for the DNA. Folate deficiency in a man may also be linked with miscarriage, as is vitamin D deficiency, actually. You know, miscarriage is never anybody's fault, but it may be male or female factor, but it can be male factor as well. So it's really important for men also to support the sperm quality. And a semen analysis doesn't really tell you what the quality is. So really looking at the nutrients that can support the quality. The CoQ10 is the same, and there are lots of studies done with coenzyme Q10 and sperm count, motility, morphology, and actually DNA fragmentation as well. So it's something that is often very much recommended. Zinc, well, the seminal fluid, very, very rich in zinc. So zinc particularly, it's important for female fertility as well, but it's definitely something that's associated with male fertility. And again, antioxidants, we know that antioxidants are really important for sperm quality. That is categorical. There's tons of study but done on that. And from the probiotic perspective, we'll be talking about that a bit later on.
Brilliant, thank you. So kind of overview really of the key nutrients for reproductive health. And obviously mentioned a lot of those just now within the others. Don't know if there's any others on here that you want to kind of particularly flag, although we will, as you say, come to some later as well.
Yeah, well, actually, something I would like to, because I've talked about, so folate requires B12 in order to enter the cells. It needs B6 to function properly. So folate really needs it needs a friend. It needs, most nutrients do actually, I find, work better, in complexes. So I'm never a fan of taking folic acid or folate on its own. It will work more efficiently alongside other nutrients. And the things like selenium, it's not uncommon. I mean, when people do sort of vitamin mineral tests, selenium does and zinc actually often both come up as being low. It's not uncommon for selenium to be low. Iodine as well, particularly if so. Iodine is often most people sort of associate it with the thyroid, but actually iodine in the is after the thyroid. The ovaries have got the one of the highest sort of concentrations of iodine, so it's really important for egg quality. And iodine is hard to get, particularly from a vegetarian or a vegan diet. So taking a supplement which includes iodine is really important. Calcium and magnesium, well, look, we will talk about particularly magnesium later on. Often calcium is something that is more accessible from the diet. Magnesium and from a multivitamin, there's never huge sort of doses of calcium and magnesium. Often I find that magnesium is something that we really I come to rely on a little bit actually. I find it very, very useful, and it's very quickly used up during stressful times. So although they're both important, it's often easier to get calcium through the diet. And if your vitamin D levels are good, then you can absorb the calcium more efficiently.
Brilliant, thank you. Um, so just looking at a 3-month plan of action for IVF. So that's the ideal, isn't it? If you're able to kind of start with supplements and lifestyle change within 3 months.
Yeah,
Um,
so eggs and sperm, I mean, it take roughly between 2 and 4 months to mature. So a 3-month plan tends to be what is recommended from a sort of preparation plan, because then you're going with the maturation cycle of eggs and sperm. In all honesty, certainly when they've done studies with sperm, you do see improvements, you see changes prior to that. And so we have to assume that also with eggs you can get benefits. And the reason I say that is because I also see lots of people going through IVF who either recommended to see a nutritionist or to seek nutrition advice, or they decide to do it, and they may not have 3 months before their IVF cycle. And first of all, when you do IVF, the start of your cycle is not what you count, because the start of your cycle you may be down regulating, everybody, and then you have to and then you have to start stimulating. I mean, it can take weeks. And so I always look at egg and sperm collection as the sort of D-Day, if you like. But also, I think that you know, you can definitely see improvements, more quickly than 3 months. And I would not want to put anybody off if they felt that, they wanted to make some changes or add some supplements in, or, make dietary changes, but they're going, oh, well, I've only got 5 weeks or 6 weeks. I really think it's never too late. It's actually never too late. But, ideally, if you've got the time, maybe 3 months. Sometimes more than that is too stressful, to be fair. But but as long as the longer the better in a lot of ways. And what we look at, yeah, is obviously reducing, I would say, removing ideally, but certainly reducing nutrient poor foods full of trans fats, highly processed foods, ultra processed foods, artificial sweeteners, that kind of thing. I mean, there is nothing wrong with having some treats, I have to say. And I'm not a fan of taking everything out of the diet, because I think that can be extremely stressful as well. But being moderate and understanding that certain things can be just treats is really useful, or just removing them it's only for a few weeks essentially out of one's life, really. Increasing nutrient dense foods, so foods that haven't been played around with ideally, and whole foods rather than refined foods. Um, Obviously the Mediterranean style diet that we've discussed, but also, stress management is important, in that we are not always in control of the stress around us or what stresses us actually, but what we can do is support the way our body deals with it. So how we eat, balancing your blood sugar levels, particularly eating protein at breakfast, actually, really your first port of call. It's not hard. And magnesium comes into it. Certain nutrients, magnesium and B vitamins as well, are really good for supporting adrenal function. Vitamin C, omega-3 is important also for stress relief. And stuff like mindfulness, meditation, yoga. Everybody finds something that works for them. But actually, using some tools is really helpful, because it gives you something that you can do rather than just sitting around. And then we do talk about reducing inflammation, but I think we talk about it a bit later on, don't we, Sophie? So I'm going to mention that in a minute.
Brilliant. Yes. So yeah, linking in is looking at the role of antioxidants, which obviously they play a big role there. So these are the key nutrients for inflammation.
Yeah, so essentially, there are a lot of things that can support inflammation, but omega-3 is a really obvious one, actually. And that's one of the reasons I'm really keen that people do consider some omega-3, either a fish oil, or if you're plant-based, then an algae-based omega-3, because it is great at reducing inflammation. And inflammation, it is one of the real issues in our modern society. I mean, we need a certain amount of inflammation in the body, to be fair, but things that are over inflammatory are not ideal. So omega-3 can be great for reducing inflammation, supporting gut health. Magnesium is very anti-inflammatory. Vitamin E, so we know about vitamin D. People don't realize how anti-inflammatory vitamin D is. And then the vitamin A that we all have issues with, because we're told that we can't have vitamin A, particularly if we're pregnant or we're trying to conceive. Vitamin A is actually extremely important from a fertility perspective and during pregnancy. However, it's true, it is not recommended in its retinol form, if you like, particularly as a supplement, which is why in pregnancy we're told don't eat too much liver, or don't eat liver actually, and don't take supplements with vitamin A. But actually, beta carotene is the vegetarian precursor to vitamin A. So beta carotene is converted to vitamin A in the body as and when it's needed. And when the stores become full, the conversion stops, so you don't overdose on it. And so it is really important. And so all the Z2S supplements, for instance, the vitamin A is in the beta carotene form. It is perfectly safe and in fact recommended in pregnancy, but it is something that people are scared of, and yet it's really, really important from an immune perspective and for fetal development, in fact, and from an anti-inflammatory perspective as well.
Yeah, absolutely. And then just to focus on ubiquinol and CoQ10.
Yeah, so I mentioned CoQ10 earlier, and essentially we all produce CoQ10. It is part of the energy production process right in the heart of the nucleus of a cell. Okay, we all produce it. Um, as I understand it, our production sort of peaks at age 25, which is not particularly helpful. So it's all downhill from there. And in fact, as we get older, and particularly into our 40s and beyond, then our own sort of production of CoQ10 is not very efficient. Now, CoQ10 is an energy provider, and I'm going to just park that for a second because I do want to talk about it. But first of all, it can improve mitochondrial health, it can reduce cellular damage. So it has certainly been studied with a lot of clinics will recommend CoQ10 for females going through IVF, and certainly it has been studied with improved IVF outcome. We know that it supports male fertility, as I said, all aspects of sperm quality, including the DNA, which must mean that it will support female DNA as well, i.e. the quality of the eggs. But so I think that it is beneficial in two reasons. One is for the actual quality of the eggs and the sperm, if you like, but also for IVF, it is an energy provider, and the egg is the largest single cell in the female body. So in order to mature an egg, you need a lot of energy. And for IVF, guess what? Trying to mature however many eggs. And so your energy production requirements are significantly increased. And so that is one of the reasons it is thought, the two reasons it's thought to enhance IVF outcome. And CoQ10 comes in two forms. It comes in its traditional form of ubiquinone, which is oxidized. It needs converting to its active form. And obviously, whenever one converts something in the body, you use up nutrients and you use up a bit of energy. Okay, so, not so efficient. Ubiquinol is the body ready, already converted active form. So it hits the ground running. Um, as we get older, particularly, and our own conversion abilities are less efficient, I certainly always recommend ubiquinol over ubiquinone because your body utilizes it more efficiently. And the other thing I would say is if you are taking either ubiquinol or ubiquinone, in fact, it's better to space out your doses because the body can only process so much at a time. And if you take everything all at once, then you maybe don't get the best out of it. But yeah, no, definitely something that I recommend for an IVF cycle, very much to support the quality and fertility when one is older, but when one is younger, even though you might not need it for egg quality, it's really helpful for egg maturation during an IVF cycle. And oh, well, I think I've already talked about CoQ10 for male
Yeah,
fertility.
maybe gone. Yeah,
Yeah, it basically it enhances count, motility, morphology, which is the shape, but also the actual DNA as well, which is really important because obviously it's got to look good, it's got to swim well, it's got to be going in the right direction. But what happens is the sperm will discharge its DNA into the egg, and the two DNAs will create this embryo. So you want good quality DNA.
brilliant. Thank you. And I think again on the female side, I think we've
Yeah.
covered this too. Um, So looking at this alongside nutrition, obviously it's everything is linked, and the Z2S approach is very much a holistic one, isn't it? So mindset as well is important to think about.
Oh, do you know the mind-body connection is more important than you think? And just to give it maybe just even a small sort of silly example is I'm thinking of somebody who I saw several years ago who really wanted to be perfect, like we all do. We want to make this right. But sometimes trying to achieve perfection is really stressful. And in the end, her IVF did work after several, when she actually basically just relaxed a little bit on the food front, on the trying to be perfect with everything she was putting in her body. So really trying, it's there's nothing worse than somebody telling you to relax. You really you want to punch them actually. But realistically, it's looking at things. So it's moderate exercise. a lot of people find that exercise really helps them from a mental perspective, and that is really beneficial, but moderate, not high intensity. High intensity, and then you sort of coming into potentially inflammation. It can increase inflammation in the body. It may increase cortisol production, but anything sort of, but feeling that you are doing something and that you're doing it fine without trying to reach for the stars, I think is really, really important. So yeah, some people, as I said, yoga, meditation, mindfulness, everybody finds something just watching silly movies. People find different things, but it is really worth finding things that work for you that make you happy, because that does make a big difference. And that actually can help with stress management, the next one. So the stress management, as I said before, you're not in control of the stress around you, or even, how you react to the stress, but you can help support the way your body works by eating well, by balancing your hormones, and as I say, certain supplements, magnesium, my big one, which we'll talk about a little bit later on, is really helpful to support stress and to support because magnesium is so quickly used up. By putting it back in again, it's called nature's tranquilizer, actually, as it happens. And then exercise, as I mentioned a few minutes ago, really, you want to move your blood around your body, you want to improve blood flow, you want to get your heart rate, you want all of that, but you don't want to exercise to exhaustion. You don't want to do very high intensity. So moderate exercise is highly recommended from a fertility perspective, and even prior to IVF, not through the IVF cycle, but high intensity, not so much. And that's for both men and women, actually. It's something that needs to be moderated.
Okay, great, thank you. And so just a bit of a closer look at female supplements for IVF preparation. As we mentioned, we'll go into a bit more detail with some, but this is one of our ultimate IVF pack for female IVF, which contains everything we would recommend to take.
Yes, absolutely. So, and it seems like such a lot, but essentially, and it's dependent obviously also on your age and your situation, but we do have, there are a good wide variety. And so this pack particularly includes the basics. My basics are always a multivitamin. You always start at a multivitamin and omega-3, and generally vitamin D, depending on the time of year, depending on your lifestyle or potentially your skin color, that kind of thing. Vitamin D is really important. But then there are various other nutrients that we find, I look at supporting the vaginal microbiome, and actually even the seminal microbiome that we talk about in a little bit. Inositol is generally recommended for women who've got PCOS, and it's particularly recommended for them. But actually, it's also been found to, enhance pregnancy rates, and it is found in the follicular fluid, so it may help with egg maturation. We have so in that there is a VitaFem Boost, which is an antioxidant complex. So that is designed to support a multivitamin alongside multivitamin to enhance egg quality. And I think NAC I would quite like to talk about a little bit later on as well, which I think I do talk about it later on. And the psyllium husk is in there because a lot of people find actually, and that's a useful one to mention, that is a fiber supplement, and fiber is really important. And in fact, fiber feeds the beneficial bacteria. But also, a lot of people find that particularly the progesterone that you're put on following transfer after IVF, and actually in pregnancy as well, is very constipating, which is not ideal because it's not great to be constipated. You have to strain, in pregnancy it can lead to hemorrhoids and stuff, but also you are not then excreting maybe some unwanted hormones and toxins. So adding some fiber, you can add some fiber in like that, can be really, really helpful. So yeah, it's not got any nutritional benefits, but it's very beneficial in other aspects.
Great. I think in this one actually we do a bit of focus on magnesium and probiotics, but not on NAC. So I don't know if you want to talk through that a little bit more now.
Oh, okay. So N-acetyl, so thanks, Sophie. N-acetylcysteine it's a potent antioxidant. It's an amino acid actually. And it is, I mean, it's great. Of course, it's been studied with sperm. I mean, what hasn't, frankly? And it helps the DNA. So it's thought to be good for egg quality. It's very anti-inflammatory. I mean, I often recommend, in fact, it has been studied with women both with PCOS and endometriosis. So it's got several benefits in that respect. It has also been studied with recurrent miscarriage and the reduction of. And so it works I think in two ways, in that it has this antioxidant effect, it's anti-inflammatory, so it reduces oxidative stress, which is potentially thought to help improve implantation rates, etc. And that's one of the reasons to reduce miscarriage. But it also works very well alongside a probiotic to support the vaginal microbiome, which is a hidden issue. And NAC breaks down what is called a biofilm, which is almost like a net catching all these unwanted bacteria, and it just dissolves it. So that is, in my opinion, one of the reasons it may also support the reduce the risk of recurrent miscarriage, because actually the health of the vaginal microbiome is very pertinent and influential in enhancing implantation rates and reducing miscarriage rates. And NAC can be very beneficial alongside a probiotic for that, which is why it is quite a good addition to an IVF pack.
Okay, great, thank you. And then just to look at the male supplements. So again, this is our ultimate male IVF pack as
So
well.
again, always start with a multivitamin, and it's very much dependent on if there are, this is the ultimate one, which would really very much be recommended to support when there is a male factor issue, potentially maybe a low count, low motility, poor morphology, and even if there has been DNA fragmentation test done, but even without it, it's supporting all aspects of sort of sperm quality. Again, a multivitamin is always the place to start. This one also includes the vitamin boost, which is the antioxidant support, the vitamin D, which, as we know, is really important for male fertility, and because many of us are low, the omega-3, the ubiquinol, because we've already discussed obviously CoQ10's role. The VitaSeed Pro is a great a supplement that it contains something called D-aspartic acid, as well as other amino acids, which are great for supporting sperm count, motility, morphology, and it's definitely been studied with improving testosterone production, which is very much linked with sperm quality improvement and the count as well. So it's very much just sort of all singing, all dancing. In there is also something called Mensieve, which is the probiotic designed to support the seminal microbiome. So the semen also has a microbiome, and this particularly can be helpful in reducing inflammation, but it's been found to improve motility quite significantly, and the DNA as well. So, and again, essentially, men, if there's ever been an infection, if they've been on antibiotics and things, all our microbiomes can be affected, and that includes the seminal microbiome. And the psyllium husk is in there to support the Mensieve, to support the proliferation of the beneficial bacteria.
Brilliant, thank you. And then just a bit of a focus on magnesium. Obviously, you mentioned it before that you use it a lot, don't you? Covers quite a lot.
Yeah, because I feel that magnesium, so in a multivitamin, there may not be a huge amount of magnesium. So a multivitamin is not designed to have a megadose of anything, otherwise it wouldn't be appropriate as a multivitamin, because a multivitamin is appropriate to be taken on a daily basis. So it's your good basic, but so many people, one of the main issues in people going through IVF is it's pretty stressful just getting to the idea of IVF itself, and then having to go through the treatment, and you're worrying about the injections and the this, and am I going to respond, and am I going to make any embryos and all that kind of thing. It's plus we do have a lot of stress in life per se. And as I say, magnesium is one of the most quickly used up nutrients during stressful times. And I mean, I literally spoke to somebody this morning about magnesium, and she was somebody who, for instance, had a reasonably sluggish bowel. And I mentioned magnesium. She said, "Oh my God, it helps so much." It's magnesium is a muscle relaxant. So again, women with PCOS and endometriosis, that's often a link with magnesium deficiency, actually. PMS and mood swings, headaches, both cyclical and sort of migraine type headaches, cramps, be they period pain, but also, twitchy eyes and muscle cramps in the legs, and all of these things can be linked with maybe a higher requirement of magnesium. And as I said a bit earlier on, I think magnesium is known as nature's tranquilizer, but it's a muscle relaxant, and it can just, it can help you sleep. I'm experimenting with this one at the moment, and my God, I have to say, it really does help you sleep.
Yeah, I
You
was saying
know,
that
yeah, it's really
makes
good because
sense.
I try as many of these things out as I can. And I have to say, I really find it very helpful. And generally, if something is giving you benefit, then you need it. Do you need to take these things day in, day out for the rest of your life? Absolutely or not. As I said, a multivitamin is designed to be taken on a daily basis, but a lot of other products you can take, for 2 or 3 months or 3 or 4 months or whatever to build up in your system, and then you can, take them more sporadically or have a break or something like that. That these are these things, but they can be really, really helpful. And, there is a thought that magnesium deficiency may be linked with, a miscarriage or inability to implant and stuff. So it is definitely something that is, I think, worth being aware of, because it's something that's just part of our modern day life. Well, the deficiency of is part of our modern day life, actually.
Okay, brilliant. And then just another focus on the vaginal microbiome as
Yeah.
well.
Actually, and one thing, and which I think was in the last slide, which I forgot to say, really important also for actual quality of expert magnesium. It's important for the DNA synthesis, it's anti-inflammatory, it's good for blood flow. So not only is it good for all the things I've just been talking about, it's actually good from a fertility perspective for the quality. Anyway, so yeah, moving on to the vaginal microbiome, so important for fertility and so overlooked, not always, but often by the medical sort of, contingency, if you like, as something that may not be relevant, but I actually think it really is relevant. And it's there are certain lactobacillus species, particularly crispatus is the most dominant of the species that proliferate in the vaginal microbiome, and they are there. It's there to basically your bacteria are your soldiers, if you like. They are your army to prevent these unwanted, sort of nasty pathogen, bad bacteria and infections, including thrush and UTIs and all that kind of thing. It is there to protect you for that, but it will also help give you a good environment in order for sperm to be able to travel up, but also to help support. It reduces inflammation. If those probiotics are known to be anti-inflammatory, but also they can help increase the chances of implantation and reduce the risk of miscarriage. And some of the nutrients that I've discussed before are also very important to support this area too.
Thank you. And so this is just a look at why all women should take a probiotic for their vaginal microbiome.
I think it's, and interestingly enough, I'm talking to more and more women, obviously, who are on the coil, who have been on the coil, and the feedback that I have been getting is that a lot of women who are on the coil tend to suffer with thrush quite a lot. And so this, if that is the case, and then you're moving towards an IVF cycle, it might indicate that you just need a little bit of support there. And the vaginal microbiome actually remains important throughout pregnancy. So although we recommend a probiotic, and I am recommending it, well, probably several years ago, I wasn't recommending it at all because the research is, it's been reasonably recent. But I think it's one of those things, it's belt and braces. We're looking at everything, and it really, is important. And I have seen very sadly miscarriages in sort of middle of pregnancy, 20 something weeks, potentially because of an infection. Could that have been prevented if the vaginal microbiome had been optimal, And I think that just, supporting that can be really, really beneficial, I have to say. I think it's really helpful. And again, 2 to 3 months. I mean, there's some really interesting studies, particularly done with the organisms that are in the femsieve. Great result after 5 weeks, even almost doubled after 10 weeks. But then what you don't want to do is then stop dead because you don't want to go backwards. So, but taking it for say 2 to 3 months and then maybe taking it, you know, less regularly if you wanted to, but it's certainly something that I have to say I recommend wholeheartedly.
Okay, brilliant. And then this is just a look at the Z2S probiotic, or for the vaginal microbiome in particular.
Yeah, and it's to be clear, it's also, it's although it's recommended preconceptually, of course, because you're looking at implantation and stuff. It's, I mean, a lot of women actually take it in pregnancy because it reduces, thrush can be a side effect of pregnancy as well as constipation, all very lovely. But so it can help with that. But also, it is the vaginal microbiome remains important throughout pregnancy to support a healthy pregnancy. So it can be relevant throughout pregnancy. It is not unsafe to take. I have a lot of questions. I know I need to stop this? The answer is no, you don't. Do not stop this after transfer, that's for sure. But you can carry on sort of indefinitely if you want to.
Okay, brilliant. And then same for the male.
Yeah, so the male one again, it's great, particularly for motility and also for sort of DNA support. And this one has been studied on a 21-day course. So it's designed to be taken for 3 weeks and then have a break maybe for a week, and then you could take it for another 3 weeks. But again, the results, even after 3 to 6 weeks of taking it, have been found to last for some time after that. So it's, it can be a short-term course, but can have quite far-reaching effects as well.
Brilliant. And then just to look at embryo transfer preparation in particular, anything that you can do here.
Yeah. So the sort of once the egg collection has happened, the sort of the high protein and the focus on the protein can be, sort of relaxed a little bit, if you like, because the eggs are out. You don't want to suddenly just, live on carbs because actually protein is important for the endometrial environment. And of course, once an embryo is transferred, and hopefully a pregnancy will take place, then of course protein is really important for fetal development during pregnancy, and actually protein levels do rise in pregnancy. But essentially, so the main difference really would be just relaxing a little bit on the protein. But certainly if somebody is going through maybe a frozen embryo transfer, so they've or even a donor egg transfer where they haven't had to maybe prepare for egg collection or something, the aim is obviously blood flow is super important. The better the blood flow the better to the uterus, the better the nutrient flow, and nutrients are really important to support the health of the endometrium. So vitamin E particularly, and selenium, folate. We know all that, omega-3, magnesium. We're back to all of those things again. Really important to support endometrial health. But in blood flow, I often recommend things like beetroot juice and pomegranate juice. And even dark chocolate, can you believe it, is rich in magnesium and something called L-arginine, which is increases blood flow. So there are various things that can support blood flow. Yogic breathing, nettle tea. There's some really helpful things. Reducing inflammation, so an increased antioxidant intake. So antioxidants are found in brightly coloured fruit and veg, and are things like vitamin E, vitamin C, zinc, selenium, the things that we have talked about. Really helpful to support embryo transfer. As long as you are not intolerant to any grains, whole grains have been found to improve implantation rates. So definitely having whole grains. If you are intolerant or allergic to gluten, obviously don't include gluten containing grains in that, but whole grains are thought to be helpful. So fiber is really important. The vaginal microbiome, as we've just discussed. And as I say, yeah, nutrients for implantation, beta carotene is another one. Zinc, selenium, folate particularly is super important. Omega-3 is really helpful for uterine blood flow. Magnesium is helpful for uterine blood flow. So it's really looking at all the nutrients actually. And coenzyme Q10 as well has been found to improve endometrial health. So that is why, for instance, we do have a frozen embryo transfer pack, and we include coenzyme or ubiquinol in that because it may support the health of the endometrium and may support implantation. I tend to recommend, although there is no known toxicity with CoQ10, and this is a question I get asked a lot, there is no known toxicity. There is not enough study done for anybody to give you the absolute thumbs up of safety. So I tend to say, if you're having a transfer, you know what you're doing, you're specifically timed. Stop CoQ10 after transfer. I mean, obviously, a lot of people are trying naturally, and they find out they're pregnant, then they stop the CoQ10. I mean, as I said, there is no known toxicity, but because there is a lack of study, it's one of those things that people can't give you a guarantee.
Mhm. Okay, and then just lastly, looking at the dreaded 2-week wait. So what do you tend to suggest to people
Yeah, the 2 week wait is actually the worst part of IVF. And I speak from personal experience as well, actually, on this, but also pretty much everybody I speak to. there is from a food, really it's just looking after yourself. I mean, from a supplemental perspective, as I say, I'd recommend you stop the CoQ10 if you are taking an antioxidant product. So, for instance, with our VitaFem Boost, hopefully it's helped do its job. It contains things like pine bark extract, which again, there is not enough study done, so it's not something we can recommend. So we tend to say maybe, t pare back maybe to the more basics. Don't stop the probiotics and stuff. But really, from a dietary perspective, it is recommended not to eat foods that you wouldn't eat in pregnancy. So, obviously no raw fish or meat, unpasteurized soft cheeses, that kind of thing. It's being sensible I mean, I wouldn't go on a sushi fest, for instance, that kind of thing. It's being, or go and decide to eat, the dozen oysters and then get very sick because actually, bacterial infections may be an issue. So it's just doing the best you can, and that there isn't very much. I mean, obviously, exercise. Well, no exercise really. I mean, walking is fine, but it's very much just trying to keep your mind occupied and looking after yourself. I wouldn't climb a mountain or decide to spring clean your house. There are various things. It's just be sensible. I think is very much be sensible, but yeah. So any mindfulness or meditation or things, though, that's the time to do that kind of thing. That's for sure.
Okay, brilliant. Thank you. Um, so we've come to the end of our presentation now. You can see here how you can keep up to date with future events that we've got coming up. Our Instagram has lots of information, a lot of Isabel on there as well. We can also take any questions people might have, but also you can have a free product recommendation call with Isabel or with Rebecca, another one of our nutritionists as well, if you've got any specific questions for you that you'd like to talk through. So if anyone has any questions at all that they want to ask now, then feel free. You can always email us at other times. But if not, thank you, Isabel, for talking us through that.
Oh,
Sorry to
well,
see
I
you.
am so sorry about this. As I said, it's never happened before, and I really don't know what's gone on. So please accept my apologies for the fact. I mean, frankly, it's probably better not to see me, but
Oh,
even so,
no.
I'm so sorry. Oh, there's a question there I can
Oh,
think.
yes. There we go. Yes. So my husband has very low sperm concentration and motility from his last semen analysis. Do you think it can be helped through diet and supplements?
Yes, I mean, it's obviously I don't know where you're at in your journey, whether you've been to see a urologist, because sometimes there is something called a varicocele, which is essentially like a sort of enlarged, varicose vein, if you like, in the testes, and that can affect both count and motility. But otherwise, yes, certainly from a dietary perspective, you know. Avoid caffeine is a big one. Reducing caffeine, reducing, soft drinks, alcohol, vaping or smoking. I mean, those are the issues. And looking at improving the way you eat, but certainly things like, for instance, something like that, the VitaSeed Pro would be a really useful addition to that. Taking a multivitamin that's got good amounts of zinc in, omega-3 as well. So I have seen, I mean, there is never a guarantee, and it might depend on why the issue is. There may be something more deep rooted, but certainly, I really have seen some great improvements in sperm. And milk is another one that I find a lot of men like milk. So again, if he's a milk drinker, be careful. Milk and cheese, be a bit careful. They do milk pregnant cows, and actually too much dairy is not great from a sperm perspective, actually.
Thank you. And then a couple of ubiquinol questions. So is there any advice on prolonged use of ubiquinol? I've been taking it for 18 months, but I'm now on a break.
No, I mean as I said, it's one of those things. It's we find it in food. It's in all living cells. I think probably all of us. I mean, I'm taking ubiquinol. I mean, I'm in my late 50s, for goodness sake, but all of us would benefit from ubiquinol. It's not like taking overdosing on vitamin D or B vitamins or calcium or something like that. Our body uses it up, and as I say, theoretically we peak at 25. So it is something that would be perfectly safe to take long term. Although, having a break, I'm always a fan of having a break every now and then. I think our body sometimes, just a bit of a day off or two or a month off or whatever is never a bad thing. But it is perfectly safe As we understand it, it's perfectly safe for in long-term use and definitely recommended as we age.
Brilliant. And someone else has just asked, how much do you recommend each day?
How much what?
CoQ10 would you
Oh,
recommend?
CoQ10.
Yeah.
Well, it depends what form it's in. If it's in the ubiquinol form, which is the more active form, the reason that ours is one capsule twice a day, which is 200 milligrams each, 100 milligrams each, because that is what's been found to be the most effective. I often recommend adding an extra one during stimulation, actually, to be honest, because I think that the energy, because our energy production requirements are higher, and it depends on your follicle count. With a very high follicle count, potentially even more. A lot of clinics will recommend 600 milligrams of CoQ10 in the ubiquinone state during an IVF cycle. So there isn't an upper safety limit. If you are taking ubiquinone, which is the traditional form, then you need more than ubiquinol, I guess. And it sort of also depends how old you are. So ubiquinone, I often recommend 200 milligrams twice a day, and maybe then an extra one, so 600 milligrams, sort of through the IVF cycle. But yeah, again, we all respond differently. There isn't an absolute on that.
Okay, thank you. And then we have a few milk-based questions. So I'll
I'm
just
sorry about the milk.
no, that's fine. So we have one, someone saying they're vegan.
Yeah.
Is tofu and soya milk okay to have? But someone else has also asked if you should avoid soy. And then another about if milk isn't great for men, is dairy okay for women trying to conceive? So
Okay,
it's kind of
so
all
I'm
mixed.
going to go backwards now. So
Yeah.
milk, it's not that milk isn't okay for men. It's just that if men, and I saw somebody once who was drinking 4 or 5 lattes a day, pint of milk at night, about 3 yogurts a day and cheese sandwiches every day. I mean, that is one hell of a lot of dairy. And he loved his coffee as well. And actually, they never, they'd had absolutely zero conception in 3 years. And they'd had two IVFs, two miscarriages, two positives and two miscarriages. And I cut him down right on the milk and the caffeine and everything. She was pregnant within 6 weeks and they kept the baby. It was really interesting. But studies definitely show that a very high saturated fat intake. So some milk is fine, just not pints of it. Going back to the soya and the tofu. So I'm not a big fan of having too much soya. There has been some study done with soya and sperm and the sort of the contraceptive issues with soya. And obviously soya is also quite estrogenic. So drinking a lot of soya milk probably isn't recommended. A bit of tofu here and there is not a problem. I wouldn't eat it 3 times a day, but it's very much that it's not really, I mean, I know that, bean curd and soybeans and stuff have been in the sort of in the Far Eastern diets for thousands of years, but in the Western diets, not so much. And particularly you don't always know where the soya comes from. There's lots of GM stuff going on. I would limit it. I'm a little bit wary of that, to be honest. So it's not a no-no, but I would limit it and I wouldn't be having, a pint of soy milk and 3 soy yogurts a day. Don't think that's the way to go.
Okay, thank you. Is magnesium safe to take throughout pregnancy?
Yeah, actually, magnesium requirements are enhanced in pregnancy. So, and a lot of women find that in pregnancy they get cramps like in their legs and their hands and their feet, and even palpitations sometimes. Obviously, something like that needs you go and see a doctor straight away. But actually, I've known of people who, there's nothing wrong with them. Magnesium alleviates it. So, yeah, our magnesium requirements are higher in pregnancy, and so I often recommend that people do take magnesium in pregnancy. Plus, magnesium is good for blood sugar control. It may reduce the risk of gestational diabetes, actually. So there are a lot of benefits. So a bit like everything, you don't want to, so that the upper safety limit, I probably wouldn't be supplementing with more than 350 milligrams a day. And you don't even need that much, but but certainly, as I say, generally there's not a huge amount of magnesium. Magnesium content of multivitamins varies, so it's worth just working out what's in your multivitamin, and then you can top up as and when you need it. But yeah, and a lot it can be really helpful in pregnancy. I often recommend it actually.
Brilliant. Another question here is my husband's fertility multivitamin has 70 milligrams of CoQ10. Is that enough?
Well, it's a multivitamin. So as I said a bit earlier on, I think multivitamins, they're not designed to have mega doses because you can't fit everything in. So is that enough? It's a very useful amount if his sperm count, motility, quality, or whatever is in question, then he would probably benefit from additional on top of that, if I'm honest. It's not a therapeutic dose. You will find that in a multivitamin you don't get therapeutic doses, but you can take what's called a therapeutic dose of a nutrient, you know, sort of either shorter or longer term. But certainly the studies actually with sperm are done. There's been studies with 200 milligrams of CoQ10 and with 400 milligrams of CoQ10. The results much better with 400 milligrams, I have to tell you. So therefore, it's one of those things, but it's very much dependent. Not everybody might need it, but it's quite a useful thing. And the other thing being as well, if anybody is on statins, so statins are prescribed for people with high cholesterol, and I do, see quite a lot of people on statins. Statins can deplete CoQ10. Just as a general rule in life, if anybody is on statins, it would be beneficial to have CoQ10 alongside. But certainly from a fertility perspective, if it's depleting you, you must take notice of that.
Okay, thank you. And how much omega-3 should we take daily?
Well, again, it's very much dependent. We're all different. We all absorb things in different ways. For instance, just for as an example, with the Zeta West omega-3s, our Ultra Omega is actually not mega dosed, but it's bound with phospholipids, which makes it highly absorbable. So it's got a many times higher absorption rate, a quick absorption rate than maybe more traditional CoQ10 not CoQ10 omega-3 that takes longer to get into your system. The studies say, a minimum of 250 or 250 milligrams of DHA. I'm prefer probably double that, nearer sort of between 450 and 500 milligrams of maybe DHA or a mixture of EPA and DHA. It's sort of, again, it's a bit like most nutrients, like things like vitamin D. Omega-3 can build up in your system. So, if you eat no fish at all and you've never taken omega-3, it might be worth taking a reasonably punchy dose of omega-3 for 3 months or something, and then you can reduce it as it sort of saturates your system a little. But there isn't a specific dose, if I'm honest. Some people find that it's really helpful for mental health, for being calm, for skin health. So, and some people don't tolerate much. So that's another thing. Even omega-3, which seems very sort of innocuous, some people find that too much, it stops them sleeping or they don't feel very well. And if you're on blood thinners, and that includes aspirin, you don't want very high doses of omega-3 because omega-3 has blood thinning. So it's very much dependent on what your situation is.
Okay, brilliant. Thank you. We have a few folic acid folate questions. So
Yeah.
again, I will just put these together because I think you should be able to answer all. So someone here has been told to take the highest dose of folic acid, 5 milligrams, but the multivitamin also includes the standard amount.
Yeah.
So is that too much to take during an IVF cycle and after transfer? Someone else has asked generally how much folate you should take. And then another person is saying their folate levels are low, have been told that once they're on the supplement, they don't need to wait to try to conceive because the supplement will mean there's enough not to worry about restoring levels. Do you think that is accurate?
Okay, let's where should I start? So I'll start with the 5 milligram one. So the 5 milligram folic acid. So folic acid, and I actually, do you know what? I realize now that I said I was going to talk about it and we didn't. So folic acid is synthetic, okay? It's man-made, and that folate is the natural active form, and you find it in food, and from a supplemental perspective, it's called methylfolate, and it is much more highly absorbable. There is a reasonably significant percentage of the world population, and actually it varies in various countries and things, that have a genetic variant that means their bodies actually don't break folic acid down very well. So folic acid isn't ideal for them, and in fact, and folate is much better for them, and they require potentially a higher amount. But folate also, as I did say earlier on, requires B12 in order to enter the cells. It needs B6 to function properly, and they're required to break down a pro-inflammatory metabolite called homocysteine, in fact. So the answer is the 5 milligrams is a medically prescribed folic acid, so I would never go against that. But I see tons of women who are on it, and it's fine to take a multivitamin on top of that. The 400 micrograms in it is not going to be overdosing for you. As to whether it's safe to take in pregnancy, you have to find out why your clinic has recommended that you're taking that much. I would tend to recommend folate in more active form, and you don't tend to need as much as 5 milligrams if you're having active folate, but some people need more. One of the questions I know was, what's the ideal amount? Well, in the UK, the recommended dose of folate is 400 micrograms. In the US, for fertility and pregnancy, it's automatically 800. And the reason I mention it is just to indicate that it's perfectly safe to take up 800. I sometimes think that we are very conservative in this country, but because this is the way, this is why our multivitamins only contain 400 micrograms, because that is what is recommended to, one can't really go against it. But I do often recommend an extra folate on top of that. I think 800 micrograms, or sometimes people take the inositol and folate, which is 200 micrograms, that gives you 600. I actually think that the extra can be really helpful. I mean, it's great to get it from the diet, but a lot of people don't have very much folate from diet. By the way, the best folate foods are dark green leafy veg, nuts and seeds, pulses and legumes, beans, lentils, chickpeas, that kind of thing. So I think that if your question is, well, I don't really know what to take, what would you recommend? I often do recommend 800. I think it can be beneficial to take a little bit more. It's certainly very safe. Again, with mega doses of folate, some people don't feel very well on it. It can make you more anxious. It can stop you sleeping. That can do other things. So it's not great just to go in on a mega dose. It's better to build it up. But 800 is normally very, very tolerated. And then the last one was about the lady who said that you've been found to have low folate levels. It could be that you have got this MTHFR mutation, in fact. It's possible. And in which case, I would recommend that you take your multivitamin. I would take folate and not folic acid for sure. But so take your prenatal, which has got folate preferably, but I would add another 400 micrograms on top of that. I would make sure you are taking 800, and I would make sure that you have got a reasonable amount of B12 and B6 in your multivitamin, not just 2 or 3 micrograms, sort of 20 to 50 micrograms or 20 plus micrograms of B12, but certainly, 10 to 20 milligrams of B6, because they all function together actually. A folate on itself is it needs a friend, as I said before. But certainly if you know that your folate levels are low, take more than the recommended dose. Take 800.
Brilliant, thank you. Another question here is, our first round failed, our second work but ended in miscarriage. My doctor is putting me on immune suppression medication as an attempt to avoid miscarriage, which is going to impact my bones. He's also prescribed calcium and high dairy diet, but I'm worried about how the immune suppression medication will impact my body.
So, I don't know how long you're going to be on it for. In my experience, most people are on the things like prednisolone. I don't know if you're doing intralipids or something, the Clexane, often for 12 weeks. Certainly the prednisolone will be weaned off after that. Clexane, some people are on it for longer. Um, I would certainly make sure you're taking a good multivitamin, because things like prednisolone, for instance, if that's what you're on, can deplete you in certain B vitamins. Magnesium, another one, vitamin D. The Clexane can certainly deplete vitamin D, which is where he says for calcium for bones. Now, if your vitamin D is low, you're not going to be absorbing calcium. Vitamin D is essential for calcium absorption. So just flooding your system with calcium isn't the way forward. You want to make sure that you are taking enough vitamin D to support calcium absorption. Plus, Clexane, in my experience, may deplete calcium. But just following, an anti-inflammatory diet, because with your immune system, so when your immune system is overactive, it's often in a pro-inflammatory state. So I often recommend potentially looking at gluten avoidance, maybe that can be very pro-inflammatory. Very pro-inflammatory nutrient. Soy, funnily enough, can be, speaking of which, can be pro-inflammatory. Keeping red meat to a minimum. Sugar is very pro-inflammatory. Artificial sweeteners and processed foods, pro-inflammatory. So really, but back to the Mediterranean diet and a nutrient-rich diet. But don't panic. A lot of people are put on this, and it can be really what you need to maintain a pregnancy. So I think I would definitely go with it and not worry too much, but certainly make sure you're taking a good quality multivitamin with good B vitamins. Take maybe some magnesium, the omega-3, making sure you're supplementing to counteract, to replenish, if you like, some of the nutrients that may be depleted.
Oh, thank you. And then we've just got a few more questions that are here. A couple about the microbiome. So, do you have any thoughts on restoring vaginal the vaginal microbiome after dysbiosis, would you recommend antibiotics, then probiotic, or just probiotics? And then
Um,
same
uh,
how long it
So
takes.
obviously, I'm not a doctor, and so I cannot recommend, prescribe, or really, talk about things like medications, and antibiotics are medications. Having said that, if there is an infection, obviously there are lots of natural ways of getting rid of it. God, it takes time though. The benefit of medication like antibiotics is that they do hit it where it hurts, and that's what you want. But yes, absolutely take probiotics, gut probiotics, and one specifically for the vaginal microbiome. You can take them together, but take them and I saw somebody recently who was sort of told that they need to take an probiotic for 10 days after an antibiotic support. I don't agree with that. I don't think that's long enough. I think you need to take, and most probiotics are pretty safe even in pregnancy. But yeah, so if you have got something that needs attention and if you potentially are prescribed antibiotics, I would say take them, but support your system while you're at it. Support your system. Sometimes you can't take probiotics at the same time. Depends how many times a day your antibiotics are, because ideally you want to leave at least 4 hours away between an antibiotic and a probiotic. Otherwise, you may as well, chuck them down the loo and chuck out, cut out the middleman. So if you are having them 3 or 4 times a day, just go with it. And once the course is finished, really get those probiotics in. And the NAC will come into its own there as well, because NAC, as I said, is a real supportive benefit for the vaginal microbiome and for its health, its for immunity and all that kind of things, keeping inflammation down, and also for as I said, for recurrent miscarriage, it can be really beneficial. It's not a magic pill, but there is a lot of study done on this.
Okay, brilliant. And just slightly linked, someone's just asked how long it takes for lactobacillus to build up.
Well, it's dependent, but certainly, as I said, a study I saw fairly recently had this sort of, after 5 weeks it was 70 something percent improvement. After 10 weeks it was something like a 90 something percent improvement. So 10 weeks is what, 2.5 months. I normally say try and give it 3 months, but you can see improvement. What I'm trying to illustrate, you see improvements from earlier, and that's good. So don't be discouraged, but don't just take it for a month. Take them for long enough. And then what I do tend to say is don't then just chuck them away and go, oh, that's fine. My microbiome is fantastic now, which it probably will be, but you don't want it to go backwards. It doesn't mean you have to take the same dose all the time once maybe you've improved it, but you want to sort of keep your hand in. So 1 week on, 1 week off, or as I say, maybe 3 times a week or something like that. You want to, and obviously fermented foods from a food perspective, things like kefir, kimchi, sauerkraut, those types of things, a high fiber diet, all that type of thing. But certainly don't let your good work be undone. And we live in a sterile world full of antibiotics in the food chain, full of sort of antibacterials, everything. And so, and sometimes our food isn't great. I mean, there's all these things, plus all these washes that we have and all these sort of, there's lots of chemicals everywhere. So, I'm a big believer in anybody, it doesn't matter what stage of life you are, that, we could all do with, it's like having your car serviced, or having an MOT. We could all do with taking some probiotics, at least once a year. But certainly for this, yeah, there isn't a specific time, but I'd say a good 3 months.
Well, thank you. And we've got a couple more questions that are on here already, so we won't take any new ones after these, but anyone that still has anything they want to ask, feel free to email in or book a product recommendation. We've had a couple of questions about cholesterol.
Yeah.
So one, is there anything good for a woman with higher cholesterol, any supplement? And one is if someone's husband has high cholesterol, and does that affect fertility?
So whether it affects fertility or not, we don't know. What high cholesterol can be linked with inflammation. That would be my sort of link with that. From a cholesterol perspective, yeah, we're back to the Mediterranean diet. So things that increase cholesterol is a high intake of saturated fat. So saturated fat is obviously found in red meat, high fat dairy. And sugar can raise cholesterol. A high carb diet can raise cholesterol. Stress can raise cholesterol. That kind of thing. Being sedentary, not drinking enough. There are several things that can raise cholesterol. Certainly, from a supplemental perspective, omega-3 is really great for reducing cholesterol. Half an avocado a day has been found to reduce cholesterol. So, a diet high in oily fish, that kind of thing, nuts and seeds are great for cholesterol. Fiber, very important because fiber binds with cholesterol and helps you excrete it from the body. So increasing your liquid intake is important from a cholesterol perspective as well. Um, CoQ10 may be helpful. I mean, essentially a good multivitamin. Yeah, there are some supplements, things like plant sterols and, sort of red rice extract. There are various things that may help reduce cholesterol levels as well. There are certain other sort of supplements that you can find out there that are thought to be helpful for cholesterol. But certainly diet and lifestyle is one of the best things you can do from a cholesterol perspective. Um, but people don't realize, they will sort of think of, I mean, eggs, for instance, don't raise your cholesterol. They think of things like, oh, it's fatty meats and things like that. But actually, a lot of us today follow a higher carb than beneficial diet, higher carb, higher sugar, and that can be really linked with. And the other thing with cholesterol is make sure your thyroid's okay. So often raised cholesterol can be as a result of a slightly sluggish thyroid too. And liver, of course, liver support your liver. So things like, milk thistle, cruciferous vegetables, beetroot, all sorts of things. There are lots of things that can support liver function. And that includes things like B vitamins and vitamin C, and some of the nutrients that we've discussed can all support healthy liver function, which is really important to get cholesterol out of the body.
Brilliant, thank you. And we'll just end on one that lots of people always ask is about protein. How much protein is enough? Trying to up her intake, but not sure if she's getting enough through diet. So I know people ask about protein shakes quite often, don't they?
Yeah, so again, it's protein is very much dependent on, you know, you as a person, your build, your activity output, your your follicle count, for instance. I mean, if you've got a follicle count of 6, you're going to need less protein than if you've got a follicle count of 28. I personally think it's harder to, and it's something that's harder to get it through food. And I do often recommend protein powders, and there are different ones you can recommend. So if you are not vegan, vegetarian, okay. A grass-fed hormone-free whey protein can be really, really helpful, and it's a good source of glutathione. But some people, if they're dairy intolerant or if they're vegan, this is not recommended for them. From a vegan perspective, I would be careful with pea protein and soya protein because both of those are thought to have contraceptive tendencies. It's just one of those what ifs, the peas used to be studied as contraceptives back in the day. They weren't very good ones, by the way, but they did have a small contraceptive potential. And if you're going for IVF, the other one that I'm recommending more and more these days, but it is not suitable if you're vegetarian or vegan, is a collagen peptides. And collagen peptides are essentially derived from bone marrow, if you like, and they're great for gut health. It's really good for the immune system. They're very easy to include. Ensure it's grass-fed and hormone-free. And I believe that we are actually bringing out our own collagen peptides powder in a matter of weeks, which is grass-fed, hormone-free, high in protein, free of additives. I mean, it's tasteless. You can literally mix it into your tea or coffee, although obviously you shouldn't be drinking very much tea or coffee, but you can mix it into anything. And I often recommend that because some people find that things like the whey protein can be some people find it sits very heavy on them, and so sometimes a mixture of different types of protein powder is great. If you are vegan, then I would probably go for pumpkin seed powder, hemp or brown rice powder, something like that. I'd be a little bit careful, as I said, about having too much pea or soy. Sorry, I should have maybe said that. But a grass-fed hormone-free whey or a grass-fed hormone-free collagen peptides powders can be really helpful, and you can mix and match them. But as I say, the collagen peptides has its benefits for joints, skin, and also gut health. And they can help reduce inflammation. So there are a lot of added we've all know that bone broth is a big buzzword these days. So obviously collagen peptides is essentially same thing, but in a powder form, really.
Brilliant. Thank you so much, Isabel. And thank you so much, everyone, for asking so many questions. It was really good. We tend to host these throughout the year. So usually around the beginning of each month. But if you sign up to the Z2S newsletter or keep an eye on Instagram, you can see when we've got them coming up. Everyone will be emailed this to watch again. And as we said, feel free to book in with a call or a product recommendation call with any of our nutritionists. But thank you everyone for taking the time to join us tonight. Thank you so much, Isabel, as
Oh,
always.
well, again, I'm so sorry again about next time, I promise you, I won't be so blasé and assume it's going to work. And I will make sure I've
Yeah,
tested
I
it.
did
But
the same.
as I
I
said,
did,
it's never
yeah.
happened before. So I'm so sorry.
Yeah, definitely going to do the same as well because it really hasn't. But yeah, thank you so much. And I hope you all enjoy the rest of your evenings, everyone, and look forward to bank holiday weekend as well. So we'll see you all very soon. Thank you.
Bye.